17% of children in the United States are obese. While there are many ways to measure obesity, it is often measured using an individual's body mass index. 9% of Asian youth is obese. And in Germany, while in 2004 the childhood obesity rate declined, after 2008 the rate stabilized over time. Causes to excess weight gain are factors such as behavior, genetics, and community influence. Behaviors are defined as the food intake, medication use, time a child watches TV, engages in physical activity, and sleep routine. Socioeconomic factors and parenting type also influence the prevalence of childhood obesity. This includes the affordability of healthy food options, social support, and policies determined by parents and the community.
Childhood obesity is related to negative psychological and physical consequences in both the short term and long term. Obese children typically have more psychological and psychiatric problems. One of the most common psychological effects is low self-esteem. A relation between childhood obesity and major cardiovascular risk factors has been found. These include high blood pressure, dyslipidemia, abnormalities in left ventricular mass and function, abnormalities in endothelial function, hyperinsulinemia, high LDL and low HDL cholesterol. There is also a relationship between childhood obesity and asthma, increasing both the risk of asthma and the intensity of pre-existing asthma. And obesity after the age of 3 can lead to a 2 times greater chance of development of type 1 diabetes. There are also many long-term consequences to childhood obesity. 69% of obese 6 to 9-year-olds and 83% of obese 10 to 14-year-olds were obese as adults. There is shown to be a correlation between childhood obesity and negative social and economic outcomes in young adulthood. Also, a link between childhood obesity and obesity-related cardiovascular morbidity in adults has been found. While the consequences of obesity in childhood are numerous, there are many ways to combat this issue.
Childhood obesity has reached epidemic proportions around the world, despite serious efforts to promote weight loss. In a study I found, a group of obese children were given a combined dietary, behavioral, physical activity intervention to determine which component or components would result in the most change. After 3 months, 6 months, and a year, the children who did all 3 components showed the greatest loss in weight. The reason for their success was the total lifestyle change and a strong support system behind them. Children who engage in regular physical activity, lead an active lifestyle, and make healthy dietary decisions have a much better chance of reducing their weight in both the short and long term. Schools have started making healthier food options available, but have shortened the amount of time children are allowed to engage in physical activity. To really help the youth of today avoid obesity, more physical education should be implemented into their daily routines.